living in Japan for about 10 years. And I have a couple of healthcare stories to share with you about national healthcare. I'm going to start with a simple story, and I want to say up front that I'm so pleased with the care that I got here, and I don't think any system's perfect, but I had as close to a perfect experience as possible. I was diagnosed last summer, about a year ago, with DVT, a deep vein thrombosis. So I had a blood clot in my leg that I got after an extended flight. And I went to my first doctor, a doctor of my choice, who referred me to an excellent hospital in Tokyo, but also gave me many other options. I was basically allowed to choose any hospital or any doctor that I wanted to, but this was the one that he recommended. So I went to GK University Hospital, and I saw a vascular surgeon. First I had all of my blood work taken and a general physical, and then I saw a vascular surgeon, and I got a full ultrasound of both legs. At which point they diagnosed the deep vein thrombosis, prescribed a course of medication, and set up 2 visits that would follow that first visit. The care throughout that day was excellent. Now, the one thing that makes this story unique is at the time I was between signing up for a new healthcare plan in Japan with my husband's company. So I wasn't fully covered under the national system. So I was a little bit nervous coming from the States. I was very trepidatious about this whole process because it was one of the first sort of larger things that I had to deal with medically in Japan. And I thought, oh, I don't think I'm fully covered. I don't know how much this is going to cost. And I had done a little research online, and a single ultrasound on one leg online I saw in the States was costing people around $2,500 just for the ultrasound, not for the doctor's visit, not for the vascular surgeon, not for any of the many people that I talked to throughout this process, and not for the blood work or the rest of the physical. So I thought it would be less expensive in Japan, but I still expected to pay, a good bit of money. So I went in that morning. I spent very little time waiting, maybe a half an hour waiting, which is actually less than a lot of waiting room time I've spent in the States. I had an excellent vascular surgeon, and then I went down to a state-of-the-art center for the ultrasound, where I had 2 doctors, a student intern and a fully accredited doctor who specialized in doing ultrasounds. They did the full ultrasound of both legs. As I said, I got my prescription, and in Japan, one of the amazing things, especially at some of the more modern hospitals, is when you go to check out at the end of your service, they have even a little automated ATM machine. So you have your little card of what you did all day, and they tracked me through the hospital. They recorded everything that happened to me during the day, and then I had this ATM card. So I went to pay. I said to them, I'm not fully covered under insurance. What do I do? They said, go to the ATM machine. So I'm really nervous, and I go down to the ATM machine and I put my card in, and my entire bill for the day, including medication, the ultrasound, the doctor's visit, and compression stockings that were recommended to use for the future, was about $120. So after I paid my $120 and I got my paper that said, come back in 6 months and take this medication, come back in 6 months. When I came back in 6 months, I had a second visit with the same vascular surgeon who pulled up my records. I felt like it was very personal and human. He knew who I was. I didn't feel like I was in some big anonymous system. And I saw my vascular surgeon, and then they had me do 2, again, complete ultrasounds of both legs. And from what I hear, this is really rare in the States. What they would have done in the States if they gave me another ultrasound at all is they would have only done the first affected leg. They wouldn't have checked to see if this had shown up in any other way. And the thing about DVT is, once they find it, many people are prone to get a repeat instance, or maybe they found the first one, but you can develop another one in the interim. So at my 6-month mark, they did 2 more full ultrasounds. And because it was a follow-up visit, and it was the prescribed follow-up after the first visit, my entire bill that day was about $19. So it was about 1,900 yen. And they followed up with a further recommendation, and this has a lot to do with the passion I feel for national healthcare in terms of preventative medicine. In the States, they would have never recommended seeing me again. But because now this is a condition that can reoccur, I have an automatic 6-month appointment with my vascular surgeon to make sure that everything is still clear. And so I know I'm getting really good quality care. I know that if something shows up, they're going to diagnose it quickly and effectively. And I'm right now blood clot free, and I feel really comfortable that, you know, if I have any trouble in the future, I know that I'll be taken care of. And it was a huge weight off of my mind. Since that time, I've gone on a full healthcare, national healthcare plan in my husband's company. And I've been told that now that the plan that I'm on now, that first visit wouldn't have been $120, it would have been about $20. For many years, a lot of mythology about national healthcare has been perpetuated in the States to make people afraid of a lot of things that I found that just aren't true. But what I want to talk to you today about is one of the benefits of this kind of system is it's based on not just giving people care when they're sick. It's based on preventative medicine. And the way that this system works, there's a lot of mythology that if you have national health care, everyone will go to the doctor all the time for the smallest little thing, and they'll run up big bills, and it'll be very expensive to the taxpayers. What I find is actually the opposite. Because simple preventative health checkups are affordable, people find out about illness or problems that they may have early enough to treat them. What most doctors will tell you is a lot of medical conditions are easy to treat if they're caught early. And I think in the States, because people are so afraid of how expensive healthcare can be, they put off going to the doctor as long as possible. So the story I want to share with you today is I just turned 40 this year. And in Japan and in many countries where there is nationalized healthcare, they recognize that your health changes as you get older, and that you're more likely to experience certain conditions after the age of 40. So about a month or two before my birthday, I got this big official looking packet in the mail, and I had no idea what it was. And I opened it up, and what it was the national system for people turning 40. Everyone gets a full packet of the medical tests and the I don't know what it's called in Japanese, but this is an experience that you go through at that age to get a full medical checkup. And everything was spelled out for me. What tests would be covered, what I should get done, what all the local, they knew where I lived, so they recommended all of the hospitals and clinics that were an option in my neighborhood. They gave me a number to call if I wanted to go to a different neighborhood or get a different recommendation. And they did a full battery of tests for me so that I could know going into my 40th birthday what my health condition was and if there was anything I needed to be worried about. I was very fortunate that I had no conditions that showed up at this time, but I know now that if there was anything to be nervous about, it would have been screened in this check. And I think that as we get older, this is so important, this peace of mind, this reduction of stress, and getting healthcare early when something can still be treated easily and a more serious condition can be prevented. And this is something they do for everybody. So you're registered when, your birth certificate is registered, they know when you turn a certain age, and everyone gets this opportunity to have this full screening at 40. And this costs me...
You get it every year.
And you get it every year after that, and this costs me nothing. So the big punchline to this story is this: when you turn 40 and you get this opportunity and they give you all this information and do these tests, it's fully covered. So there is no cost at all to the patient. And I can't stress enough how much I think this would solve a lot of big concerns and big expensive procedures that happen for people in the States. And so this is a system I would love to see implemented in the US.